Good afternoon, Kahnawà. It's November 3rd, 2021. So we're here to give you a quick update on where we're at regarding the COVID-19 situation, and Lloyd will be joining us after I speak. So first, an update regarding vaccination. So as you may or may not have heard, all vaccinations for the foreseeable future will be administered at the Knights of Columbus. So we are no longer vaccinating at KMHC. If you do happen to have an appointment scheduled for COVID-19 vaccines, tomorrow they will be at the Knights of Columbus. We're also vaccinating for the flu vaccine. So if you do want an appointment for the flu vaccine, please check out the KMHC website. You can book your appointment on Click Santé, and we will be vaccinating for at least the next month. Moderna will be administered tomorrow, and Pfizer clinics are already set up for next week. So for those who have an appointment already, those appointments are maintained at the Knights of Columbus. For those who want an appointment, then again, please call the KMHC for us to be able to book your appointment. Just to give an update regarding Pfizer vaccines for 5 to 12-year-olds, we are expecting confirmation from Health Canada shortly that those vaccines have been approved here in Canada, and we will be providing you with further information shortly. However, we are preparing to start administering vaccines for 5 to 12-year-olds around November 15th. So we'll give you more information and confirmation as we receive it. We also expect to be vaccinating for boosters for all seniors and perhaps even for the population in general soon. Again, we're expecting that information shortly. We do not have it yet, but I'd like to keep you up to date on what is up and coming because we do get a lot of questions about this. So as soon as we have more confirmation and as soon as it's been accepted here in Canada and in Quebec, then we will let you know, and we'll be prepared to meet the needs of the community at that time. I wanted to just give an update about our inpatient situation. So as was communicated through a press release, we do have 2 positive cases in inpatient, 1 employee and 1 resident. So this is in fact the first resident within any of our residences, so KMHC, T-Bell or ILC. It's the first resident who has COVID. I would like to just advise you that the patient is doing well. The symptoms are still quite minimal, and this is a really, really good sign. I wanted to thank every single service department at KMHC. The action was swift as soon as the outbreak was identified, and measures were implemented very, very quickly in order to reduce the possibility of transmission to other residents. And it really was a huge endeavor, a lot of work from a lot of different people to make that happen. And the teams were just awesome and really made a difference. So we're really grateful for that and for the hard work of the KMHC staff. I also want to let the community know, and especially families of residents at KMHC, that this outbreak has had an impact on our staffing, and for that reason we've reached out to the Kahnawà Fire Brigade for assistance from the paramedics, and they are providing assistance and additional staffing for KMHC over the course of the next few days. Again, this is wonderful community support. Considering the situation that we find ourselves in, it's been a really rough 2 years, and this episode of COVID-19 has had a very has been difficult for the staff, and therefore we do require some assistance that we're getting very graciously from many different paramedics. So thank you very much for your collaboration. Also, just a quick update, part of the measures that we undertake when we have an outbreak is to test all employees and all residents. So I think we still have 2 employees that we're awaiting results for, but every other employee and resident that has been tested has received a negative result. So yes, we still have an employee and a resident who tested positive, but everyone else who we identified as contacts. And in fact, in an outbreak situation, in order to get a good picture of what's happening in the area, in order to identify where the index case was, it's best to test all employees and all residents, just to make sure that we're containing the virus. And we've done that in all of our outbreak situations from the beginning of the pandemic. This is no different. So all those test results came back negative, which is a really good sign. It means we now have a good picture of what's happening. We know that we have isolated those who need to be isolated, and we have ensured to avoid any more transmission throughout inpatient. We still have this window of 14 days for those who were direct contacts to the positive cases, 14 days to watch out for the development of symptoms, and therefore, as we've mentioned before through other outbreaks, the outbreak is only considered ended 14 days after the identification of the last positive case. So as of today, the outbreak will end on the 14th of November. Definitely, if no other cases are identified between now and then, visitation will open back up to how it was before on the 14th of November. And we're still in the process of evaluating whether visitation can open up sooner on our second floor, so Unit 2. But again, we will keep you up to date with that information on our KMHC website and through press releases and communication with families. So in terms of our numbers in the community at the present time, I'm really happy to say that our COVID-19 numbers have remained stable over the last little while. We currently have had a total of 276 COVID-19 cases since March 2020. And in this fourth wave, there have been 147 COVID cases. Presently, as of today, we have 5 active cases. There are 3 new cases from the last time we presented results to you. These are the same numbers as we presented yesterday or that we posted yesterday. There has been no additional cases today, and those 5 active cases include the 2 positive cases from KMHC. We currently have 20 people in isolation. And so we have received a few questions about whether we will be moving to green, considering that there are 5 active cases. So I just want to remind the community of the recovery plan that we presented, which really clearly outlines the many variables that are involved in moving to the green category, not just number of cases. It's based on many different variables. And if you are interested in looking at that recovery plan again, well, our commission, our Public Safety Commission met today, and we approved making that document public, so it will go out onto the website this evening. And there is a graph in there that will give you all of the information that you're looking for, including all of the variables. Ultimately, public health does make a final decision based on many different variables and on the epidemiological situation at any given time. And it is stated in that document that we do have to be in a stable state with all of those variables under control for at least a 2-week period before we move to green. So I invite you to go and look at that document, which has been adopted both by the council chiefs as well as the Public Safety Commission, and it provides a lot of interesting information about roles and responsibilities, about how our community organizations and various stakeholders work together to keep the community safe during, again, these still very difficult times. And so if you are interested in having that information, it will be available to you probably by tomorrow morning. So that's my update for today. I'm going to pass this on to Lloyd, who will speak more about our commission meeting today and some changes that are coming to some of the measures in the community. Thank you.
Thank you very much, Lisa. Good afternoon, everybody. Certainly, it's encouraging news overall that the community has been in a relatively stable state for a number of weeks. As we said before, we've been give or take a few cases, roughly 10 cases, down to 5 and back up to about 15, but generally around 10 cases for a while. Obviously, things could be better, but overall, if things are stable and manageable, and the principles of being able to contact trace within 24 to 48 hours, among many other factors, is maintained, we are in a generally a good place. And with that in mind, and looking at what's happening in and around Kahnawà, we were in the past few weeks looking at the current measures that are in place for the community, and looking at what could be modified and what could change moving forward. So we did have a Public Safety Commission meeting this afternoon, and we did present some ideas and such to consider and implement in the community in the shortest possible time frame. But before I get into some of those items, I just wanted to also state that, again, the overall goal of the Public Safety Commission in terms of COVID-19 and during the recovery phase is to continue to reduce measures and move us closer and closer to a state of normalcy. As I said last time I was on the air, what normalcy will look like in the weeks and months to come is still a question mark, but we will continue, as long as things are stable, to continue to relieve the measures going forward. And also, many of the measures are now recommendations. Since June 21st, when the state of emergency ended, until now, many of the languages that we've been using, I should say, has been changing from a directive to recommendation to versus saying it's no longer a requirement, but it's a suggestion. So some of the terminology we've been using has been changing. Again, more and more empowering individuals to make choices that's best for themselves, empowering organizations to take on their mandates to the fullest extent, allowing sports organizations and such, again, to do the same, knowing that public safety concerns are still first and foremost. But with that said, there are still some public health measures that are still a part of a Directive 65 that have to remain in place for the time being. And those also have been updated today and will be posted again on the website very shortly, so that everybody has the most up-to-date information regarding mask and distance and so on. So what we discussed this afternoon primarily was what can we do to allow for more freedoms, more business opportunities in the community to prosper. Again, obviously looking forward to the upcoming season. Looking at Christmas, believe it or not, sooner rather than later, and a lot of people requesting having Christmas gatherings of some sort, restrictions on various restaurants and stuff. So what we looked at very closely, and in terms of restaurants and bars and breweries and social clubs, things of that nature, where there has been restrictions on capacity, where we feel we're confident at a place where we can remove those restrictions and allow the other public safety measures to work and do their job in terms of masking as required, as well as the proof of vaccination in these places, would allow us to feel comfortable enough for us to be able to no longer have restrictions on capacity for restaurants, bars, breweries, and social clubs. Again, how that's implemented exactly is at the discretion of the business owners or the social club on how they're going to implement that. But from a public health perspective, we feel we're in a good place as a community to allow that to happen. Very similar, with we do have some unique businesses like cigar lounges and such. Again, no capacity limits will be lifted on there, and again, public safety measures will be in place. Also, and I know it's been a very rough time over the past while in terms of restrictions on very ceremonial funeral churches and things of that nature. Again, restrictions will be lifted on those areas, and masking when appropriate, distance when appropriate, and vaccines where appropriate will be the only things that will apply. Outdoor public gatherings remain at 50 people, whether public or private gatherings. And the purpose behind that primarily is we're still not confident at this point in time it is wise for large groups of people to gather for an extended period of time. So we still don't want to have large groups gathering at this point in time, especially when the vaccination status is unknown. So you don't know who you may or may not be in contact with, who may or may not be vaccinated. So again, it is an important factor to look at as well. Again, we're putting this information out there for people to make the best possible and for your family. Keeping in mind, if you are part of that more vulnerable group, either unvaccinated or somebody who's immunocompromised, you should really look at your risk level very closely and make decisions accordingly. Organizations in the community are free to implement their return to work or work from home mandates as they deem necessary or required for them to get back up to full capacity. Sports have been operating and will continue to operate, including the arena, to have allow for more people to come watch games, watch their children and such. Again, over there, the proof of vaccination is still required, but sports are allowed to continue and will obviously have further ability to have their leagues operate in a more efficient manner. I know a lot of the organizations have been talking about they wanted to rent halls or the social clubs that wanted to rent halls and stuff. Again, that is going to be also something that's going to be loosened or restrictions lessened. No live music and karaoke and dancing, things of that nature is also going to be permitted. Again, public health measures that accompany that still must be followed. But again, we want to move towards that path, towards normalcy, where people could again enjoy some of these festivities, some of these celebrations, or some of these activities that they enjoyed prior to the pandemic. So we're taking these steps. As we made the commitment, we're going to keep guiding the community down the path to a normal situation. These are probably going to be in place for the foreseeable future, looking towards the holiday season, letting people be able to celebrate in a more meaningful way, a much more meaningful way than last year this time, but still being cautious, still making wise decisions, and making sure that we don't have any major outbreaks in our community. So again, collectively working together, Public Safety Commission, Public Health, providing recommendations, guidance, and direction at times, but cooperation from business, social clubs, and community as a whole has got us to where we are today and will continue guiding us as we move forward. So with that, all this information will be also again released publicly on the webpage as well as posted on 911 Facebook page. So with that, I'll talk to you soon. Manigawahe.